It's finally time. We're going to talk about the integumentary system. What are we without our skin? So I'm just going to go through the basics. It's not that complicated. And if you want to take some notes, you can. And I will definitely leave this link on the blog so you can get to it again. So the integumentary system is composed of the skin and the extra accessory structures around that. It protects your body from injury and infection. Of course, any breach of the skin, any break in the skin, our number one concern is infection. And it also helps the body maintain my favorite word, homeostasis, by making sure that you don't lose too much water, that you don't lose too much heat, that you also get rid of the waste and things through perspiration that you need to. Skin, the largest organ in the body, you probably already knew that. There's very thin parts of the skin and very thick parts. Think about the skin on your eyelids versus the skin on the soles of your feet. It's very, very different. The skin really tells everything. It's a window to what's inside. So you can actually look at somebody and tell just by looking at their skin color whether they're anemic or their heart's not working as a good pump, or maybe they've got breathing difficulties. If they're yellow, they might have some liver disorders. If they're kind of ashy, they might be battling cancer. And of course, if they're pale white, they might have shock. There should be some color behind your skin from good blood flow. So when you see that white skin, and couple that with some other symptoms, you can think maybe that person's in shock. Also, if the skin's very red, you can think maybe hypertension, maybe some high blood pressure is causing those red cheeks or the overall red skin and red neck. So really, the skin is the window to what's going on behind that. And you get good at assessing skin, and you can get good at guessing what might be going on with the patient. Think about somebody who's let's see. If the skin is blue, there might be lack of oxygen. So red, white, and blue determines different things when you see that in somebody's skin. There's 3 layers to the skin. The outermost layer, the epidermis. Epi is a prefix, medical prefix, meaning above, and dermis is always relation to the skin. And there's dead cells on the top of the skin. And there's things called keratinocytes that make up 90% of that. That's also where your glands that secrete oils and odors are, as well as the hair follicles. And the melanocytes that give you the color of your skin, or the pigment of your skin, are also there. And of course, you've seen on my vitiligo, I'm lacking melanocytes. So I don't have pigment in part of my skin. So then there's the dermis, or the true skin, and that's where the blood vessels and nerves are. So think about if you stuck a pin in your skin and you broke through some of those blood vessels or hit a nerve and it hurt. That's puncturing the dermis. And really, it's amazing when you think about every little inch of skin has 15 feet of blood vessels. That's why pretty much wherever you impale the skin, you get back some blood. And then there's the subcutaneous layer. That's where the fat tissue fat is, and that cushions the body's organs. It's the innermost layer. It's the subcutaneous. Sub, below. Cutaneous, the skin, below the skin level. Hair and hair follicles. The skin has hair follicles in all areas of your body except the palms of your hands and the soles of your feet. Hair, helps to block foreign particles from entering the body structure, such as around the nose and the eyes. And when you look at the hair, you take a piece of hair, the visible part, you can see if it's still in the body, it's called the shaft. If you pull it out, you can see this little ball at the end of every hair shaft, and that's called the root. There's 3 types of glands found in the skin. There's the oil glands, which are sebaceous glands. You don't have any of those on the palms of your hands or the soles of your feet, but you have them everywhere else. And oil helps to waterproof your skin and keep your skin soft, and keep warmth in as well. And then there's the sudoriferous glands, or the sweat glands. The word odor is actually kind of built right in there. And it helps to regulate the body's temperature and body waste. And people's sudoriferous glands work all different ways. You've got those sweaty people that sweat if just sitting still, and those people who can work and never raise a sweat. It's really not so much a lack of those glands as it is the body's response to stress. And then the ceruminous glands are in your ears. Those are the earwax glands that secrete that earwax. It helps keep foreign bodies out of your ears. And then you have your nails, which protect your fingers and toes, and they're made up of dead skin and on top epidermal cells. and the root is covered by the skin where the nail attaches, and that you see that lanula, that little crescent-shaped area that's near the root on the nails. That's where the root actually is on the nail. So that lanula is that crescent-shaped thing. You can see it on your fingernails if you're not wearing any nail polish, which I think some of you might not be. So here's some assessment techniques. The field of study for the skin is dermatology, ology meaning the study of, derma always relation to skin. Dermatitis, itis is a suffix that means inflammation of, so dermatitis, inflammation of skin. You can actually see a lot of what's going on with the skin just by looking at it. You can see if there's a lesion, the way it's shaped and what color it is, and of course eventually you might have to biopsy it to find out what it is, but just observing it can tell you a lot. Although I have to tell you, skin rashes are very hard to diagnose because everybody's skin's a little bit different. You've seen irritation on different types of skin, how different that looks. Everybody has their own unique finger and toe prints. The papillae are those ridges on your fingers and the soles of your feet as well, where the skin is thick. And sometimes you can actually see by looking at the papilla, they have certain patterns in Down syndrome, for example, that indicate that that condition is indeed going on. Whoops. All right, so another disorder that some of you might be familiar with is acne vulgaris. You get a lot more oil secretions when your hormones are not stable during puberty. You can get it on your face, your chest, your back, and there's a little picture of that. I think a picture's worth 1,000 words when it comes to skin disorders. Albinism is when there is no melanin produced and that the person ends up with no coloring, so they end up a white color. Alopecia is a condition of the skin that causes baldness, and it could be spotty or it could be all over, no eyebrows, no eyelashes, no hair whatsoever, no body hair. So it could be, mild pots, chunks of hair gone, or it could be across your whole body. I showed you a picture of what athlete's foot looks like. That's a fungus treated with antifungal medication, and that picture is why you should always wear flip-flops if you're staying at a hotel or standing in a shower that's not your own at home. Cellulitis, any kind of break in the skin is an invitation for bacteria to come in, and cellulitis can happen from something as small as a skin cut or a mosquito bite that you scratch. It's a bacterial infection that gets in the subcutaneous layer of the skin, and there's a picture there of how the redness and the swelling can just spread like wildfire. It actually can, a paper cut can cause death if cellulitis occurs, and it's not just staph infection. It could be a strep infection. You have bacteria normally found on your skin, or it could be introduced on the object that you cut yourself with or whatever. Chloasma, you see this kind of patchy discoloration that looks kind of like a butterfly across the nose and cheeks on this person. Chloasma is a patchy discoloration of the face. There's really not a lot you can do about it, but it's unsightly, and people with a lot of pigment in their skin tend to get it more often. Cleft lip or palate are conditions that people are born with, where the lip does not form completely and you get a cleft, or the roof of the mouth doesn't form completely and you get a big opening there, or you could have both. Makes for feeding babies very difficult. Of course, visually an otherwise perfect baby is born with this unsightly opening in the lip, and so the plans to close that usually are implemented fairly quickly, although until the child is fully grown, you can't really complete it if the palate's affected too. It affects teeth and feeding, and usually involves multiple cosmetic surgeries. Contact dermatitis is just an allergic reaction from having some contact with something that your body reacts to. And this is a picture around a navel where probably somebody had, maybe they were allergic to fabric softener or something, and their pants were snug and they broke out there. It's kind of a red bumpy rash. Dandruff is actually a condition of the skin where dead skin cells from the scalp flake off, and you guys are all familiar with that, and sometimes needed to be treated with medications. Decubitus ulcers are sores, and they occur over the bony prominences of the body, the base of the spine, the heels, even at the back of the head. It's caused from being immobile for a great length of time. Usually if somebody's sick or elderly and their immune system and their skin integrity is compromised in any way, the areas will break down. It's very hard to treat because it comes from the inside out with the bone pushing against the skin. And usually the patients are compromised medically anyway and have an awful lot of nutrition issues, circulation issues. So decubitus ulcers are something that if patients are in bed for any length of time, you really have to stay on top of by keeping the circulation to those areas good and preventing the bones from pushing on mattresses or on objects for any length of time. Eczema is really a group of disorders that are allergic reactions, and this is a pretty good picture of eczema. It's sort of a plaquey kind of rash over the body, and it can be from head to toe or it can just be in a small area. The next picture I've showed you is a fungal infection. That's a classic ringworm. Ringworm is a fungus. It's not a worm. And as you can see, those are circles about the size of dimes. In their classic ringworm, the inside looks like it's healing and the outside looks red. And they're all, like always, around the size of a dime or a nickel. So if you see those on the body anywhere or on the head, on the scalp, get an antifungal medication quickly. A furuncle is like a boil or a bacteria on the hair follicles. You see it in the nape of the neck. Hirsutism is abnormal growth of hair in unusual places, and I included a picture of that. Impetigo is a really common childhood infection, and if you look at this picture, you'll see this child has mustardy yellow scabs over this rash. Then the rash usually starts around the nose or mouth where there's moisture, and then it trails through the rest of the face, and it can get on the whole body. Initially, you treat it topically. You have to scrub off those yellow scabs to apply the ointment. But if it gets severe, the children often end up on an oral antibiotic as well. Kaposi sarcoma is a rare form of cancer that happens in the blood, and it spreads, and it gives you these big, unusually shaped pock marks, common in patients with HIV whose immune system is compromised, and then they end up with this rare cancer. Lupus, another butterfly rash across the face. The rash itself is benign, but it could be a chronic situation where, because lupus doesn't go away, it's in your system, you end up with that rash kind of coming and going. Psoriasis is also a plaquey chronic skin disorder where too many cells are produced at the top level on the skin, and then you get those plaquey rashes too, a little more whitish than the psoriasis we saw that was more generalized and over the whole body. But rashes can be from viruses, they can be from infections, bacterial infections. Kids are very susceptible to rashes, especially if they have a fever or something. Scleroderma is a rare autoimmune disease that affects the blood vessels and the connective tissue of patients, and you can see that the pinky finger has been severely affected, where that top tissue gets excoriated or rubbed away because the connective tissue underneath is compromised. Skin cancer, the most common is basal cell carcinoma, which is the first picture. It's just irregular borders and red. Squamous cell almost has like a sucking in, pulling in at the center of the lesion. Again, you see the lesion's not a circle, it's kind of an odd shape. And the most deadly is this dark lesion. That's melanoma. And you can actually see it looks deadly. You'll see irregular borders. And you'll see like dark discoloration. So any kind of growth or abnormality or change in a wart or mole should be checked out, because skin cancer can be treatable, but melanoma can be deadly. Skin lesions differ in texture, color, and growth. And again, we all have staph and strep on all of our body at any given time. For the warning signs of melanoma, again, watch for changes in moles and pigment and consistency over a highly pigmented area, or any kind of inflammation around a mole or a wart. And that concludes our discussion about the integumentary system. Thank you so much.